seen with the insurance has gotten hard as far as all the things that organizations are being asked to do and the increasing demands and things that they're putting in there. And some of the drivers for that, the premiums have been going up, the coverage levels have been decreased for some insurers, the carrier loss ratios for 3 years in a row. This is not the current year, this is a couple of years ago. But as we went through the pandemic and all of the attacks and the increases in the attacks in healthcare, their loss ratios increased dramatically over 3 years. So those are drivers, and the demand for insurance increased dramatically during the same period of time. And some carriers in some markets are not covering ransomware payments, or they're adding other exclusions to their coverages now. So we're seeing an increase in exclusions, and we're seeing all of these other drivers causing that insurance costs to go up. So all of this to say, another good reason why to use HICP guidance to bring up the maturity of your program, document that program, track your maturity over time, so that you can avoid not only a bad day or ransomware, but you can also stay insured, or help you stay insured or get through a renewal. One of the things that we saw, the insurance carriers and Lloyd's back in 2021, 22, they published and said by 2023, they're working toward making sure that the cyber policies include station-based attacks and infrastructure, and trying to exclude those from insurance carriers. So we've been seeing some more exclusions and so forth. And a number of the carriers have tried to use the acts of war clauses in their policies to get out of paying claims. And so we've been watching this pretty closely as to lots of changes we're seeing in insurance policies. One of the things that changed really, really fast as we saw renewals incredibly quickly, we saw renewals by insurance companies include exclusions for tracking, such as pixel tracking, into their policies, and renewals. On the very next renewal, just within weeks or months of those events coming to light, we saw them in insurance policies. So one thing we have sort of going for us, and we were watching this very closely, because if those of you that have tried, and I'm sure Elvis can weigh in on this, attribution is hard. And knowing who attacked you and who the exact person is, sometimes attribution is really, really difficult. And was it an act of war or not? Was it an act of military action? And so one of the cases that was recently came forward this year in May, as Merck, the insurers from Merck were trying to use the act of war clause in the deny Merck from a big payout for insurance when they went through the NotPetya infection. And so the New Jersey appellate court ruled, it says this week, that was back in May, that the earlier decision in the group could not use the war exclusion in their insurance policies because they had attributed it to Kremlin-backed. They weren't able to link it to actual military action. So we're watching some cases come through in the States and other countries, and really watching these exclusions closely. So one of my pieces of advice is watch your renewals very close. The exclusions are going up for certain kinds of attacks and or potentially ransomware, and limitations in these policies for some of these threats. So with that, any comments on that, Elvis, before we ask for the questions?
Yeah, absolutely. I think the important thing to do for organizations is if they can work with the FBI, like we have information that typically you don't, and then you have, firsthand information that we don't. So if we can get the information, indicators of compromise, those can help us figure out attribution better. And so, I mean, the thing is, we're not going to play with the evidence. Like we'll see where the evidence takes us. So I hate to say you may or may not be happy with what we come up with, but at least you'll know for a fact. And I think at the end of the day, that's what your board of directors, that's what your C-suite wants, is they just want to know who actually, did the hack. And really that's our job, right? Is to find who the hackers are and then hold them accountable.
Now, I can attest that it works. And, Elvis, you might address some of the things I hear, fears I think people have are maybe movie induced, I'll say. If you call the FBI, I think you know where I'm going. If you call the FBI and you say you've been hacked and so forth, this missing representation that maybe the FBI is going to show up and confiscate your servers. Maybe there's some drama or movie things that have maybe set the stage that are not correct.
No, you're absolutely right, Will. I mean, I know I can't actually tell you the last time I've worn my raid jacket. It's probably been over a decade. However, I have visited many victim companies, and the way it works is, actually post-COVID now is, we'll hop on a Zoom call like this, right? And I'll say, hey, what do you got? What can you share with us? And, we'll schedule meetings. We'll, use a secure file transfer protocol to, share whatever log files that you're willing to share with us, whatever, malware samples or anything. And then we'll run them through our systems. And then like the number one benefit that I think we bring when a company reaches out to us and shares information with us is we can look through our holdings and see what we have to share back. So as you can imagine, we have investigations on every major ransomware variant. I think we're north of 140 different ransomware investigations now. And so what we do is we collect evidence from all of the different victim companies, right? All of the healthcare organizations that were hacked. And then we can collate all of the different indicators and then share those back out to you, right? And so maybe certain indicators were used at one hospital, but maybe different ones were used at another one. So information that we share back with you can help you with the threat hunting to make sure that your incident response team and your external, consulting incident response team can really clean off your networks. I think that's the value add that we have.
Absolutely. And it can even go as far as eventually you take down the bad actors that it might take longer than we all want, but we'd like to see it happen faster. Obviously, sometimes these take time, but I can attest that it works and the information is there. And I know being a part of InfraGard for a long time and having access to some of the intelligence and notices and things that are provided through InfraGard is very useful.
Yeah, no, that's great, Will.
Teams.
And for those of you who are attending this and haven't been there yet, I strongly recommend you just Google InfraGard. This is how it's spelled. And then it's an individual membership. The only two requirements, you have to be an American citizen and you can't have a criminal record. So that's pretty easy. And then as Will attested, we've been actually better now about pushing advisories faster than we used to. So like just earlier this week, we pushed out a new updated cybersecurity advisory on AVOS Locker ransomware. And so, we have an investigation on AVOS Locker. And so any of the new indicators that we have are now in your hands so that you can, add them to your blacklist and, update your firewall procedures. So those are just the little things that the US government is trying to help.
A lot of the information sharing groups, including sharing a lot of good information around Move It, for example. That was probably the most recent one that healthcare and some of you even on the call today may have experienced. I've seen a number of organizations suffer not necessarily directly from Move It, but it's highlighted the third-party risk issues again with Move It because many organizations have been affected by third parties that were using Move It. And maybe they didn't even know it, that those third parties were using that. Maybe those third parties were keeping a lot of data on those Move It servers. That highlights the need and reason to really dig into third-party risk and use the HICP guidance to be evaluating that risk and how your data is transferred. The regulators are going to want to know where is your PHI? How are you storing your PHI? Is your PHI encrypted? And where are you sending to and from your trading partners and all those business associates? And it's a daunting task in healthcare to inventory and know where all of that is. But the Move It item that occurred has really highlighted the third-party risk recently again and why that's so important.
Yeah, I agree.